Hello. Dr. Carmen Robinson is the Chief Medical Officer at Western North Carolina Community Health Services in North Carolina. She is a fellow of the American Academy of Family Physicians, a mother, and oh yes, an opera singer at the Piedmont Opera. In this episode of Baransu Balance Podcast, Dr. Carmen Robinson shares her personal journey with anxiety, depression, and the importance of seeking balance in mind, body, and spirit. Stay tuned for some valuable insights and practical health tips.
Baransu Balance Podcast with Dr. Ince emphasizes the interdependence and importance of a healthy mind, body, and soul.
Hello, Dr. Carmen Robinson. Welcome to another episode of Baransu Balance Podcast. Really appreciate your coming. I'd like to start off with the fact that you and I have similar taglines. You said in your introduction of yourself that you enjoy teaching your patients about their interconnectedness between the mind, body, and spirit, with emphasis on psychosocial balance. So I was surprised because you seem to be a person that just has it all together. I was surprised to see in that same bio that at one point you said that I lived with panic attacks, taking anxiety and depression, but I came out on top. Can you tell me a little bit about that?
Definitely. So first of all, thank you so much for extending the invitation to participate on this. Part of what I really, really enjoy doing, besides directly taking care of patients, is talking to the people in my community through whatever forum the opportunity comes about, whether it's online like this venue, or at church events, health fairs, panel discussion, schools. I really, really don't take for granted that I have a unique opportunity to share my expertise and my experience with my community. So thank you so much. Yes, I have lived with anxiety and depression um, since 2007. Now, I say 2007 because that was actually when I was diagnosed, but I know in retrospect that I had symptoms prior to my official diagnosis. At the time, I was in medical school, and I noticed that um, whenever I would sit down for tests, there would be almost like a white film that would appear on the test screen. We took our all of our tests on computers, on laptops, and the screen would just go blank. It took me a long time to finish, and I was not scoring commensurate to what my knowledge was, what my knowledge base was. If you were to give me, oral tests, I I did very well on those, but when it came to the actual electronic version, it was a whole body experience that I had. Um, I thought that I wasn't studying hard enough, so I started removing myself from things that I enjoyed, friends. I would start to isolate so that I could study more, pouring more over books, pulling away from my family because I thought, well, you're not doing well on your tests, you don't have time to do all of that. All of these things are symptoms of depression and anxiety that I was learning about it, but I didn't recognize it in myself. Finally, I was able to reach out for help, get the diagnosis, and then because of that, because I sought help, because I got an accurate diagnosis, I was able to get the treatment that I needed, which included um, therapy, which I highly recommend for everybody. Anybody who's listening to this podcast, you need
Absolutely.
a therapist. You need a therapist. People think I'm not talking about them, but if you hear me speaking, I'm talking to you. You need a therapist. So that was really the biggest thing that I could have done. There was a time, at the time that I got diagnosed, I started on medications that helped regulate serotonin, which is your emotion and mood hormone, one of your emotion and mood hormones. It helped regulate serotonin in my body. Um, I started going back to the balance that I knew that I needed. So I couldn't spend all my time studying. I had to take time and do the things that brought me balance, including exercising, including, sleeping, including spending time with the people that I loved and who helped nourish and pour into me. Those three things were the mainstay of my treatment and what helped me get back to my center and my balance. Once I was on the right treatment, I've never had an issue with test taking anxiety again. Now, I will say, I want to be very transparent. Depression and anxiety are chronic conditions. So that means even though I'm not acutely anxious, I'm not acutely depressed, I don't need to be on medications right now. I still make sure that I check in with my mental health continuously. So I keep a therapist, regardless of if I'm in an acute phase or not. I stay with a therapist. I continue to try to achieve balance in my life so that I can stay healthy.
Thank you so much for sharing that with us, Dr. Carmen Robinson. And again, most people would not have known that about you, considering the achievements that you've made in your life. When I think of Carmen, I think of chief. You were chief medical resident at Baylor College of Medicine, a prestigious medical school in Houston, Texas. Your last role, you were chief medical officer, and you're currently a chief medical officer, giving back to society in Asheville, North Carolina, in an underserved area. I understand. So I thank you so much for sharing that story. Anxiety and depression is so common in today's society, and in all age groups. Your age group, which is our audience, and the adolescents, and then the older age group, like myself, trying to figure it out even at my age.
Mm.
So I want to start with, or ask you some practical questions. So, in women in your age group are trying to do it all: take care of the kids, the dog, the house, and at work. From what I remember and what I understand is still going on today. Do this age group, 30s and 40s, do they have to take time to have their checkups, medical checkups? And what does that entail?
Mm. Yes, so you'll have to invite me back so I can do my full, it's called The Well Woman. It's a talk that I give
Okay.
for women of all ages that talks about risk-based screenings, age-based screenings, and what all women should be looking for, regardless of age, regardless of any genetic or family risk factors. So, to answer your question, absolutely. You have to go in and check in. We talk about disease prevention, health maintenance. Part of what I do as a family doctor, I kind of put it in three main categories. One is preventing disease, health maintenance. Two is if there is a presence of a chronic disease, how do we keep that managed? How do we keep that from progressing to um, an accelerated disease state or an urgent or severe disease stage? And then three, if there is a person that is at an advanced disease state such that their life or limb are threatened, how do we keep them in a quality of life before their time on earth is finished? I have the privilege of doing all three of these things as a family doctor. So the most important thing is to prevent disease and maintain one's health. And that
Absolutely.
involves seeing your primary care doctor at least once a year, at least once a year. More often if you've got certain risk factors. at that, and we call you can hear it a lot of different ways. You may hear it called the annual physical or the complete physical exam, or for women, the well woman exam. And that is when you go into your doctor and they are looking for common conditions or diseases for which you have no symptoms. That's called a screening. I've got no presentation of a disease, but my doctor is doing certain diagnostics, which includes the hands on the body for a physical exam, um, blood or urine testing where appropriate, radiological imaging where appropriate. We are looking for the presence um, of silent disease. So we're looking for high blood pressure states. We're looking for elevated blood sugar. We're looking for elevated cholesterol, potential for heart irregularities, cardiovascular disease, cancer. So once a year, when you go into your doctor is looking for silent diseases. That has to be done at least once a year.
Can I
Um,
ask you about
yes.
the diabetes screen? So
Mhm.
is it a blood sugar, or do you run a fancier test on your average patient?
On your average, so there are, very simple tests, and then there are more advanced tests. So a simple test could be just a finger stick. That finger stick looks at what your blood sugar is right at that point in time. And typically, it can give us, particularly if you're fasting, in that you've not had anything to eat or drink besides water or black coffee or tea without cream or sugar. If you've been fasting for at least 8 hours, that finger stick can give you a relatively accurate picture of what your blood sugar is. Um, and we want it to be within a certain range with that fasting blood sugar. Or more commonly, what you'll have is a not a finger stick, but a fasting blood sugar as part of a metabolic panel. So they will actually draw blood from your arm, that will look at what your blood sugar is. It'll look at your kidney function, sometimes your liver function as well as your electrolytes like sodium, potassium, calcium. And that's a fancier test that we use, but it's more common. And then if you've got certain risk factors like obesity, family history of diabetes, your doctor may actually get something called a hemoglobin A1C, which is an even fancier test that lets you know what your blood sugar has been on average over a 3 month period. That is the most accurate test that we can do for screening for
Do,
diabetes.
do you have to ask for that test if you have a family history, or
No, no,
not
typically,
necessarily?
typically the fasting blood sugar, which is done taken out of your arm, typically your fasting blood sugar can give you an accurate
Okay.
picture of what your blood sugar state is. If your fasting blood sugar is abnormal, then it requires us to do that second level test, which is the
Okay.
hemoglobin A1C.
Okay. So now what about the men in our lives, the 30 and 40-year-old men?
Mhm.
So they're they're the superheroes, and certainly don't have any fear of needles from what I understand. So what do you recommend for them? Is it similar or a little bit different?
Both. It's similar in that they also need to be coming in at least once a year. I like to joke around and say if it weren't for the moms, the spouses, the girlfriends, I would not have any male patients. So it is typically much harder for a man who feels healthy to come in to get their annual exam. Um, so it is
Okay.
important that they come in as well. It is very important. A
Okay, so
lot of the
I'm sure there are some exceptions of men that, are really proactive and want to make sure that things are caught
Absolutely.
early.
There are always exceptions. There are always exceptions. By and large,
Mhm.
women are more likely to come in for preventive health screenings than men are. But that number is starting to even out. We are seeing more and more men because of the outreach that's being done um, over media, primary care, the government doing a lot more outreach to get our male patients in and the screenings that they need done. A lot of it is the same as women: diabetes screening, cholesterol screening, cardiovascular disease screenings, some cancer screenings, but there are some cancer screenings that are unique to men that we would want to make sure they're coming in to get done, in particular prostate cancer screenings.
Okay. And the colon cancer screening at age 45 is a
Yeah,
relatively new
so
recommendation. We used to
right, it
say
used to
wait
be
till you're
50.
50.
Right, right. It used to say
Mm,
wait until you're 50, but it's taking the unfortunate death, premature death of, we all recall celebrity Chadwick Boseman, who died in his 40s from
Wakanda.
colon cancer. Pardon?
Yes. I just said Wakanda forever.
Conda forever. And so it's taking
Mhm,
more and more people at younger age being diagnosed, unfortunately dying,
mhm.
that the screening guidelines have changed to 45 for an average risk person. That's man or woman.
Right. And we're not sure why that shift has occurred, whether it's a lifestyle. Most likely it has something to do with our lifestyle, less active and less whole foods.
It it's hard to say definitively,
Hmm.
because in the case of Chadwick Boseman, he,
Hmm.
by all accounts, lived a very healthy, active life
That's
that's
correct.
required for, pace that, he was having to do different roles,
Hmm.
healthy eating, regular exercise.
Hmm.
Um, but
Yeah.
yes, by and large, our society, um, for a long time shifted to processed foods, and away from whole foods. Now you can see that the shift is starting to move back. There are a lot of more
Hmm.
vegan options, vegetarian options. You've got Whole Foods, you've got Fresh Market, Trader Joe's that have a whole the focus is a lot on whole foods and whole
Hmm.
ingredients and plant-based diets. And so
Hmm.
you are seeing that that is becoming more of the trend. But yeah, it's hard to say what the reason is that people are getting cancer earlier and dying sooner. And I will just put a plug in. It also seems that earlier diagnosis, earlier death, or rather younger diagnosis and earlier death is happening more in communities of Black and Brown people. Um, Not sure,
Again,
why that
again,
is.
again, we're not sure, whether it has to do with stress, lifestyle, access to healthcare,
All
but
of the above.
that's correct. So, Dr.
Dr.
Robinson,
Robinson,
I hear an
I
echo.
hear an echo. Not on my end.
All right, so I'd like to ask a little bit about the kids. 'Cause I know you have a wonderful daughter. I have a granddaughter, 3. And the screen time recommendations, I believe, have changed. And can you tell me a little bit about what you recommend as a family practice physician? Um, you take care of people of all ages. So what is it that you recommend?
Yeah. So that is going to be a complicated question with a complicated answer that I will answer. So you've got recommendations from American Academy of Pediatrics as well as the American Academy of Family Physicians. And through those recommendations, you'll see anywhere from 30 minutes a day to there were at one point it was 2 hours a day. On average, we're saying an hour. Those are the recommendations. In practicality, if we are looking at um, parents who lead very busy lives, or even single parents who have limited help at home and sometimes need the assistance of the devices so that anything can get done around the house: laundry, cooking, cleaning, things like that. We don't shame or blame parents for using that from time to time in order just to get things done. What we want to emphasize more than 30 minutes and then turn the device off is, what other options for entertaining or stimulating are you providing for your children? Are you reading to them? Are you playing with them? If they are watching a show, are you watching it with them and having that interaction? Okay, I'll give the example of Daniel Tiger. Well, why do you think Daniel Tiger was sad in that instance? Carson's my daughter's name. Why do you think Daniel Tiger was sad? Would you be sad as well? That interaction can often negate, the potential damage or negative effects that just simply sitting in front of the
So,
television or
so
device
if
can.
you're sitting with Carson and watching this show, then how do you get your laundry done?
Right. So it's all about,
I'm just
it's
asking.
there's nuance there. I know there have been times where I've been in the kitchen cooking. Carson has been in the kitchen dining area watching, and then I'll, be listening to what's going on, and I can cook and interact in those cases. And then
Okay.
certainly there are times where she's, watching the show, PBS Kids, and I'm going back and forth to the laundry or running the vacuum cleaner, things like that. So there's nuance to it. There's not a hard and fast rule, but in general, 30 minutes to an hour is the recommended limit per day.
Okay. Well, we've gone around the world. We talked about anxiety, depression, men's health, women's health, children's health. Why don't we just throw in COVID while we're at it?
Why not? 'Tis the season.
Just tell me. Yes, we're in the midst of a mini surge here with flu, RSV, and COVID. So just tell me one war story in the COVID war that you fought. I believe you were on the front lines before we
Was
end.
so that, we're not out of COVID. COVID is now more that thing that it's always walking beside you that you try to avoid as much as possible, but it's not as much the unknown terror that it once was. We know much better how it works, how to protect ourselves. The question is, do we as a society, do we avail ourselves of those protections? Which is a whole nother talk that I give. But I remember in 2020. um, I'm trying to think. Carson was born in December 2019. And right when I came out of maternity leave, which was in March of 2020, the next day, the governor declared in North Carolina declared a state of emergency. And
Oh
I
my
was, I
goodness.
really wasn't paying attention to what was going on while I was on maternity leave. I was focusing all of my attention. I had no idea what was going on. I came
I,
out and it was like
I
a
don't
post-apocalyptic
I don't think
society.
anyone had any idea.
When the day I came out of maternity leave, I had gone to CVS for something, and the shelves were stripped bare. And I said, "Is this the end? What is going on?" Turned on the news, state of emergency. I said, "Okay." So we really didn't start knowing a lot that year. Didn't have a vaccine. There weren't any really good treatments. There were all kinds of theories going around. We were at a
Were there
state of emergency
any
within healthcare. Yeah,
stories that
yeah. So I recall, I had a patient um, who, so fast forward to 2021, we finally had a vaccine. I had a patient with really, really bad COPD. He also had poor control of his diabetes, and the vaccine had come out, and we were really wanting our patients, especially um, our high risk patients. He was one. He was 73 years old, a Black gentleman. Encouraged him every visit. Please, please, please get your vaccine. You are the one that is more likely to go into the hospital and possibly die from COVID. Please get your vaccine. He had heard on the street, rumor mill, got bad information, refused to get his vaccine. I mentioned it at every visit with compassion, never with the strong arm, always with compassion and understanding. And after about 3 months, he had not come to any of his visits. And I called his family. I said, hey, he's missed several of his visits. Um, I'm concerned about his diabetes. We're entering cold and flu season. What can we do? And they told me that he had passed away. It turned out he had been hospitalized about 6 weeks prior to my call,
Oh.
and he was out of state, so it wasn't a place where they knew his PCP to send me the records for to notify us that he was hospitalized.
Mm.
And he had passed away, and it was really one of so many that had that same story,
Mm.
did not avail themselves of protective measures, and succumbed to
Yeah.
this virus.
Yeah.
Extremely,
It is
extremely sad.
it is and was heartrending. Thank you for that, and thank you for your service. I'd like to, any last words, Dr. Carmen Robinson, about the importance of balance of the mind, body, and spirit in your life? And
Yes. Get a therapist.
okay,
Get one. Get a therapist and understand that you are not alone. I think part of the demon and monster of depression and anxiety is it's so isolating, which makes it harder to identify and treat. So understand that you are not the only one that has experienced these symptoms, and you probably aren't going to be, and definitely are not going to be the last. So get a therapist, know that you are not alone, and you deserve to be well. So seek your own wellness.
okay. Well, thank you so much. Until we meet again.
All
Thank
right.
you.
Thank you.
Thank you, Dr. Carmen Robinson. I have personally also benefited from therapy. I know that it is important to pray and meditate, but I believe God has sent us therapists to help those of us who have suffered from anxiety and depression. You wouldn't hesitate to see a heart doctor if you had a heart problem, right? So if you have a mental health issue that is affecting your relationships or preventing you from achieving your potential at work or school, consider getting help. Remember, this podcast is for educational purposes and does not substitute for the advice of your healthcare and mental health provider. Get your checkups, and good luck to our young parents in encouraging our kids to limit their screen time. This is Dr. Christine Ince wishing you a balanced mind, body, and soul. Please like, subscribe, follow, and comment.